This week, menopause took center stage at the highest levels of U.S. government in an unprecedented way, not as something to dismiss or endure quietly, but as a significant health transition it truly is. The U.S. Food and Drug Administration, the FDA, which is responsible for protecting the public health by ensuring the safety, quality, and proper labeling of medications, medical devices, food, and cosmetics, convened leading experts from across the country to discuss what millions of women have been waiting to hear: that their experiences matter, their suffering is real, and there may be evidence-based solutions that have been kept from them by fear rather than facts. This week offered something that has been in short supply for women going through menopause: hope. Welcome back to Pleasure in the Pause, the podcast dedicated to empowering midlife women to connect to their bodies, pleasure, and power in perimenopause, menopause, and beyond. I am your host, Gabriella Espinosa, and it is my pleasure to be here with you today. Something extraordinary happened this week that will impact the lives of over 50 million women currently experiencing menopause in America. And that's just the beginning. When you consider that 1.3 billion women worldwide are in some stage of menopause, we're talking about a global health revolution that started in a conference room at the FDA. The FDA convened an expert panel on menopause and hormone replacement therapy for women, the first gathering of its kind in over 2 decades. This wasn't just another medical conference. The panel's mission was clear: to discuss treatments, education, and comprehensive care that goes beyond mere symptom management. This was about fundamentally reimagining how we approach women's health during menopause. Menopause, a topic once silenced and shamed, has finally entered serious public discourse. For decades, menopause was something women endured quietly, a topic avoided in medical schools, brushed aside in doctors' offices, and reduced to tired stereotypes in popular culture. Women going through this natural life transition were often made to feel invisible, irrelevant, or worse, like their very real suffering was something to be ashamed of or simply tough out. But something profound has shifted in recent years. Women are refusing to stay silent about their experiences. They're speaking up in workplaces, demanding better from their healthcare providers, and sharing their stories publicly. What we're witnessing is nothing short of a cultural awakening: the recognition that menopause affects every woman who lives long enough to experience it, and that dismissing or minimizing this universal experience has real consequences for women's health, careers, relationships, and quality of life. We're talking about insomnia that impacts your ability to function day to day, anxiety that comes out of nowhere, brain fog that makes you question your competence and professional abilities, bone fractures that can be fatal, vaginal dryness that can steal your pleasure and intimacy, and yes, those hot flashes that aren't just uncomfortable, but life-altering. The fact that the FDA convened this expert panel signals that menopause has finally reached the highest levels of medical and governmental recognition. This isn't just a women's issue anymore. It's being treated as a significant public health matter it always should have been. As a board member of the national nonprofit Let's Talk Menopause, I'm proud of our efforts to spearhead the grassroots campaign to remove the black box warning from vaginal estrogen. Our advocacy helped make this hearing possible. Leading today's historic hearing was Dr. Marty Makary, the new head of the FDA, who has made women's health one of his top priorities in his first 100 days in office. And regardless of your political affiliations, I was deeply heartened to see that the FDA under the current administration is seriously examining these issues that affect half the population. Dr. Makary shared his own personal story about his mother, who was denied hormone therapy during the height of the fear around 2002 and subsequently suffered bone fractures that may have been entirely preventable. He emphasized that bone fractures in older women can be fatal. It's not just about quality of life, it's about survival. He also emphasized that 50 plus million women over the last 20 years haven't been offered hormone therapy. They haven't even been asked about it by their doctors because of lingering medical dogma that prioritized fear over facts. His commitment to challenging deeply held assumptions and separating dogma from evidence gives me tremendous hope that we're finally going to see policy changes that reflect current science rather than outdated fears. Now, let me walk you through some of the most significant revelations from today's expert panel, because every woman needs to understand what's been hidden from us. Dr. Heather Hirsch, a board-certified internist, opened the historic FDA hearing with powerful words that set the tone for everything that followed. She didn't waste time with pleasantries. She immediately declared that we are harming women by not having clear facts, sharing the devastating story of her patient, Denise, who woke up in perimenopause with such severe symptoms she told her husband she was having thoughts of self-harm. Dr. Hirsch used her opening moments to systematically dismantle decades of medical dogma, boldly stating that vaginal estrogen is categorically safe for all women, period, and that the FDA's black box warning is simply wrong and should be removed. Her message was crystal clear. 50 million American women between ages 40 and 60 deserve policies based on current evidence, not outdated myths and the medical establishment's fear-based approach to hormone therapy, because that is doing more harm than the treatments themselves. Dr. James Simon, a menopause and hormone therapy expert, delivered perhaps the most damning evidence against current labeling practices. He demonstrated that low-dose vaginal estrogen, the kind used to treat vaginal dryness and recurrent UTIs, cannot be detected in the bloodstream. The logical disconnect is staggering. How can the FDA place its strongest possible warning on a treatment that doesn't even travel through your body systemically? How can something that can't be measured in your blood cause heart attacks, strokes, breast cancer, and dementia? Sexual medicine expert, urologist, and former guest on Pleasure in the Pause, Dr. Rachel Rubin, delivered one of the most emotionally charged and personal testimonies, revealing how the FDA's own labeling nearly killed her mother. As one of the few fellowship-trained sexual medicine urologists in the country, Dr. Rubin has spent 7 years advocating for the magic of local vaginal hormones, which she boldly declared are not only similar to, but actually way better than Viagra, because they treat sexual dysfunction while preventing over 50% of urinary tract infections. But her fight became deeply personal when her immunocompromised mother lay in a coma in the ICU for 6 months. The medical team refused to continue her dose of vaginal estrogen, justifying their refusal by citing the black box warning about strokes and heart attacks, despite Dr. Rubin's expertise in showing them the data. She had to roll up her sleeves, educate the entire medical team, fight the pharmacy's computer alerts, and teach the nurses how to administer a treatment they'd never heard of, all while her family feared losing their loved one to preventable urosepsis. Dr. Rubin emphasized the staggering economic impact. UTIs cost $7 million in hospital visits annually and make up 25% of infections in older adults. Yet, if Medicare patients use the $13 tube of vaginal estrogen, we could save our government billions of dollars per year. Standing before FDA leadership, she made a simple but devastating point. There is not a single study in the literature that says local vaginal estrogen causes stroke, blood clots, heart attacks, breast cancer, or probable dementia. Yet the FDA's label claims exactly that, forcing families like hers to fight for treatments that could save lives. Her presentation was both heartbreaking and eye-opening. Dr. Howard Hodis, USC researcher and hormone therapy data expert, delivered what might have been the most shocking revelation of the day. After analyzing the Women's Health Initiative data in detail, he revealed that the study never actually showed a statistically significant increase in breast cancer. Let that sink in. The fear that has kept millions of women from accessing hormone therapy was based on data that wasn't even statistically significant. Even more remarkable, the estrogen alone arm of the study, women who had hysterectomies and took only estrogen, actually showed a decrease in breast cancer cases and breast cancer deaths over 20 years of follow-up. The treatment we've been told causes breast cancer may actually protect against it in many women. Yale University researcher and professor Philip Sarrell presented perhaps the most devastating statistic of the day. Using data showing that women aged 50 to 59 who received estrogen had fewer heart attacks and deaths, his team calculated that almost 50,000 women died between 2002 and 2012 simply from avoiding estrogen. In the years since, that number has likely reached 150,000 women. These aren't theoretical statistics. These are mothers, daughters, sisters, friends who died because fear triumphed over facts. Urologist and former guest on Pleasure in the Pause, Dr. Kelly Casperson, delivered a provocative testimony, opening with a hypothetical about a safe, inexpensive drug that could reduce hip fracture disability by 50%, then revealing that drug is testosterone, developed in 1935 but still unavailable to women 90 years later. As a urologist who prescribes testosterone to men daily for hypogonadism, she exposed a stunning gender inequity. Men have over a dozen FDA-approved testosterone formulations covered by insurance, while women who naturally produce testosterone and experience the same hormone decline have zero approved options. Casperson systematically dismantled the FDA's regulatory failures, noting that male testosterone products were approved with just 6 months of safety data, while female formulations have been rejected for insufficient safety data, despite 50 plus years of use and trans men receiving 10 times the dose safely. She painted a vision of 108 million American women energized, focused, and ambitious, not in spite of their age, but because they are supported through it, demanding the FDA fast-track female dose testosterone, declassify it from DA scheduling based on 1980s Olympic doping scandals, and stop forcing women to microdose male products or pay cash for unregulated alternatives, while men get comprehensive hormone support covered by insurance. The education crisis in menopause care was starkly illustrated by Dr. Mary Jane Minkan, an OBGYN from Yale University. She presented data showing that only 30% of medical residency programs in North America teach menopause education. This means 70% of doctors are graduating without any formal training in managing a life stage that affects half the population for potentially 30 plus years. Menopause education didn't just decline after 2002, it essentially died. The women who are now hitting menopause weren't paying attention to the Women's Health Initiative in 2002. So now they're experiencing debilitating symptoms and going to doctors who know nothing about what they're going through. This is why women see an average of 5 to 7 doctors before getting help for their symptoms. Dr. Roberta Diaz-Brenton, neuroscientist, NIH-supported brain researcher, shared her brain research that was both fascinating and alarming. She explained that 2/3 of Americans with Alzheimer's disease are women, and it's not simply because we live longer. During menopause, the female brain undergoes a substantial decline in its ability to use glucose as fuel. Without adequate estrogen, the brain goes into starvation mode and begins consuming its own white matter, those crucial connections that allow different brain regions to communicate. This is why we experience brain fog, memory issues, and difficulty finding words. But when estrogen is introduced during the menopausal transition, it can prevent this cascade. The timing window is critical. Dr. Vonda Wright brought the brutal surgical reality to the FDA hearing, speaking as a fellowship-trained orthopedic surgeon who has looked at 100,000 people in the eye and grown tired of treating preventable suffering. She opened with the story of Miriam, a patient who suffered a devastating hip fracture from a simple kitchen fall, a woman who had chronic UTIs, was never offered vaginal estrogen, and faced a 30% chance of death within a year from complications that could have been prevented. Holding up the actual metal rod she had surgically implanted into Miriam's hip, Dr. Wright delivered stark statistics. 40% of the 80 million American women over 40 will develop osteoporosis at rates 4 times higher than men, losing 15 to 20% of their bone density in the critical 5 to 7 years around menopause when estrogen plummets. With the weight of surgical experience behind her words, she declared to FDA leadership, "I am tired of women suffering, and I am tired of having to put big metal objects for a condition that we could have prevented," emphasizing that estrogen isn't a band-aid for elderly women, but a critical prevention tool that must be used during perimenopause before 20% of bone density is irreversibly lost. Now, I know some of you might be thinking, but what about the risks? Surely there must be some truth to the concerns about breast cancer. OBGYN and menopause expert Dr. Barbara Levy made a crucial distinction. Not all hormones are the same. The Women's Health Initiative studied specific formulations, conjugated equine estrogen and synthetic progestins in women averaging 63 years old. Applying those results to bioidentical hormones in women actually going through menopause today is scientifically invalid. It's like studying one blood pressure medication in 70-year-olds and applying those results to all blood pressure medications in 45-year-olds. Dr. Levy, who described having PTSD from the devastating July 2002 WHI announcement when her patients' phones rang off the hook in terror, emphasized that estradiol, natural human estrogen, binds receptors completely differently than conjugated equine estrogen, making it inappropriate scientifically to conflate the results. She stressed that the WHI researchers were asking a legitimate question. Should all women at all ages start hormones to prevent heart disease? Which is why they purposely enrolled older women to get enough cardiac events. But this has nothing to do with treating perimenopausal women in their 40s and 50s for symptoms. The tragedy, she explained, is that this age confusion has led to hormone therapy being placed on the American Geriatric Society's list of potentially hazardous drugs for the elderly, creating insurance barriers and prior authorization hurdles that prevent appropriate care for the very women who would benefit most. What made today's expert panel so significant was its focus on comprehensive care beyond symptom management. This wasn't just about treating hot flashes. It was about recognizing menopause as a critical health transition that affects cardiovascular health, bone health, brain health, and overall longevity. Dr. McCary acknowledged that removing the black box warning, which the FDA is seriously considering, isn't enough. We need widespread education. There's an enlightenment happening in the medical field, recognizing that this may have been one of the greatest mistakes of modern medicine. But here's the thing that gives me hope. Women haven't stayed silent. The campaign to unbox menopause, to remove these misleading labels, has been driven by real women saying, "I'm not willing to suffer. I'm staying in the workplace longer. I want to feel good. I want to be healthy as I get older." Yet, even as we celebrate today's progress, women are still getting mixed messages. Just this week, the Journal of American Family Physician published an editorial claiming there are significant harms from hormone therapy and limited benefits. This is exactly why this week's hearing was so crucial. We need to separate evidence from outdated dogma. We need doctors who understand that the benefits of properly prescribed hormone therapy can be life-changing and life-saving. So what does all this mean for you, wherever you are in your journey? If you're experiencing menopausal symptoms that are impacting your quality of life, whether it's hot flashes disrupting your work, brain fog affecting your confidence, sleep disruption destroying your relationships, or mood changes that don't feel like you, know that you have options. If you're dealing with vaginal dryness, painful sex, or recurrent UTIs, vaginal estrogen is one of the safest and most effective treatments available. If you're concerned about bone health, heart health, or cognitive function as you age, hormone therapy started within 10 years of menopause onset may offer protection you didn't know existed. But here's what I want you to understand most of all. You deserve accurate information. You deserve doctors who are educated about menopause. You deserve to make informed decisions about your health based on current science, not 20-year-old fear. The FDA is opening a public comment period on this topic. Please go to the FDA YouTube channel to listen to the full hearing and leave your public comment. This is our opportunity to ensure that today's expert testimony translates into policy changes that will help millions of women. This isn't just about hormone therapy. It's about the fundamental principle that women's healthcare should be based on the best available evidence, not on fear or outdated assumptions. 50 plus million women have been denied access to potentially life-saving treatment. How many more will suffer while we wait for change? As I close today's episode, I want to acknowledge something important. Change is hard. Medical paradigms shift slowly. There will be resistance from some corners of the medical establishment, but women are no longer willing to suffer in silence. We're no longer accepting that's just part of aging as an answer. We're demanding evidence-based care that acknowledges our right to feel vibrant, healthy, and comfortable in our bodies throughout our entire lifespan. Your symptoms are real. Your suffering matters. Your quality of life is important. You deserve to have all the information you need to make the best decisions for your health. This week's hearing represents more than just a policy discussion. It represents recognition that women's health matters, that our experiences are valid, and that we deserve better than fear-based medicine. Whether or not you choose hormone therapy, there is hope now that you can make this decision based on facts, not fear. Armed with accurate information and working with knowledgeable healthcare providers, you can chart a path through menopause that honors your individual needs, values, and health goals. Thank you for listening to this episode of Pleasure in the Pause. Want to help me spread more pleasure in the world? Please subscribe, rate, or review this episode and share it with someone you love. Your voice matters in this conversation. Until we meet again, remember, your pleasure matters.